Hello guys, once again, welcome back to my channel. Today I'll be doing something different from normal, different from what I used to do. Today I'll be having a health talk with one of the medical students here. I think he's in screen class. We'll be having a health talk concerning asthma. What are the causing symptoms and what the patient. Um, Something can you break it up? Yeah, I'll obey to Pat Underhill medical student, University of Calabar. Okay. So the part when we're hearing of asthma at work, and we don't really know, we don't really understand what asthma is. Can you explain that to us? Okay, asthma is a respiratory disease condition characterized by increased mucus production, inflammation, reversible airway obstruction, and airway hyperresponsiveness. So I will love to break that down. It just means that um, the characteristics of this condition is as a result of the inflammation, the body way of trying to protect the respiratory tract. So when this protection or protective mechanism happens, you have this characteristic like wheezing, coughing, yes, chest tightness, and shortness of breath. Yes, that's the difficult thing. When you say correcting, the body was correcting the respiratory tract, what do you mean by that? Okay, first, let's say there's an injury, yes, the particular part of the body, or maybe there's an infection, or anything, maybe in the respiratory tract. So the body tries to protect that part by one, sending enough blood to that area. So that's part of the protective response. So once it sends enough blood to that area, also what it does is the blood vessels there that are around that area become liquid. So all the white blood cells, the protein, they leak out of the blood vessels, all trying to help that particular area in the infection going around that area. So when these blood vessels get leaky, they enter into the tissues in that area, the tissues become swollen. You see, and when they become swollen, the airway, the air passage become narrow. You see, when it now becomes narrow, that is where the whole breathing, that difficulty in breathing, and that's breathing is that sound you hear saying you're breathing. Trying to cut off. Yes, yes. So that's the inflammatory process. So can we follow the causes of asthma? What means cause asthma? The cause is not named. The cause is rather called risk factor. Yeah, risk factor, things that expose you to the, or we call it triggers. So pollen, dust, smoke, some drugs, some drugs like NSAID, infections, upper respiratory infections, and this from animal for dander, from cats and dogs, they all trigger led to asthma. So can you tell us the symptoms if someone has asthma? Can you tell us the symptoms? How can the person hear asthma? Yes. Asthma, if you say, okay, I'm having chest tightness, that I'm wheezing, and you're having difficulty in breathing, and maybe cough, you will conclude that you have asthma. Yes. Before you say you have asthma, this has to be recurrent. The wheezing and shortness of breath, at least that difficulty in breathing, needs to be recurrent for you to say, oh, I have asthma. But just know that if you have asthma, these four signs and symptoms are very important, that you know that, okay, I have asthma. So this asthma thing, is it curable? And then you know, you, especially when it is something that is genetic, yeah, you can just manage it. So how can they manage that? How can they manage it? First, the management starts with history taking. When your history is taken by doctor, then prevention is very important. So you avoid those triggers. You avoid those. Then you also stay away from, yeah, don't stay, yeah, yeah. Then like if they are cooking in the kitchen, just because just leave when they are trying food and all that. Um Also, like I, I can't really give medical advice, as to which drug to take. Yes, but they are relievers for them, and you should also learn how to use your inhaler. Yeah, you can have an inhaler, but you don't know how to use the inhaler. So you need to know how to use your inhaler, and also we have short acting drugs and long acting drugs. So the long acting drugs can help you for prevention, for preventive purposes. The short acting is for acute attack. So if you had it at that moment, yes, sudden attack, take it at that moment to get ready. So what are the complications? Complicated complicated if you do not deal with your asthma, one yes, or your way of your living will be affected. Like I had a colleague that um sometimes asthma can be stress induced. Being in an example is stress on its own. So that stress can trigger that. And if you have an asthma attack in the middle of an exam, so your quality of life will be reduced. Then also we can have something called pneumothorax. Pneumothorax is air in the thorax, air in the ear, right, in the thoracic cavity. So that is also a complication. And then there's also very one important, they call it practice asthmatically. Yes, it is rather a severe form of asthma. It is asthma but a more severe form. The double those symptoms times it does it you're not having that it can be life threatening if not. And the management is still the same with the normal. Okay, I would have asked you of the treatment of asthma, but he's not yet a medical professional, he's still a student. So if you have any of these symptoms, I think you should see a doctor. So Mr. Prince, can you give us summarize anything? Okay, asthma is like I said, a respiratory condition. Yeah, and it's something that can be managed, not something you should be worried about as per whether you should go out that day, and then just always be with your inhaler, and also do proper follow up. If you visited the doctor and he has prescribed drugs, you should still go for follow up at least 1 to 3 times in it. Like after 3 months, you go for your, and also so that they review your medications. Yes, because some of these medications come with side effects. So if you are properly educated on the side effects, so you not get worried when you are using them. And not they see qualified technicians that are qualified to having all those things for you. So I think we'll stop it today. So and like, subscribe, and watch out for my next video. Thank you.